Hey everyone, welcome back to Static Pharmacology here on EMTV. I'll be giving you a patient care scenario, and your goal is to develop a treatment plan that emphasizes pharmacological management. For an extra challenge, I'll be putting a 1-minute timer on the bottom of the screen. When the time is up, we'll do the scenario walkthrough, and then I'll give you my treatment. Enjoy the card, and good luck.
3, 2, 1.
Now this card presents a pretty scary situation. Taking care of any critically ill pediatric patient is definitely a hair-raising experience. Let's go ahead and take a look at the scenario now in a little bit greater detail. You were dispatched to a private residence for an accidental medication ingestion. Your patient is a 5-year-old male who ingested an unknown quantity of his father's glipizide. Your patient is lethargic, confused, and is profusely diaphoretic. His parents deny any other ingested substances and deny any medical history. Your partner attaches the monitor and obtains the following vital signs: blood pressure 100/54, pulse 133, respiratory rate 27, SpO2 95% on room air, and a blood sugar of 30. Now this scenario is a little bit more complicated than you may realize. The medication that was overdosed on is what's known as a sulfonylurea. It's a class of drugs that's designed to lower blood sugar by stimulating the beta cells within the pancreas. Stimulation of the beta cells then causes a release of insulin into the bloodstream. Insulin is how our body moves glucose from the bloodstream into the cell. Now unfortunately, our brain needs the glucose that is freely available within the bloodstream. So overdosing on this medication will create a cycle of hypoglycemic events that will be refractory to traditional treatment. What adds to the difficulty of this scenario is the fact that your patient is pediatric and we don't know the exact amount of pills that were taken. Let's go ahead and now take a look at the treatment. Just like all my other cards, I'll begin treatment by regurgitating the mantra, Scene Safe, BSI, IV-O2 Monitor. The next thing I'll do is contact Poison Control, and this is simply because this is an overdose, and they are the most up-to-date authority on all things poisonings. After getting recommendation from Poison Control, I'll then proceed. Because this patient is pediatric, and as most medications and protocols for pediatrics are weight-based, I'll need to obtain the patient's weight. I can do this by using the Broslow tape or any other similar pediatric weight-based estimation tool. It is important, though, not to just guess. I'll then want to administer IV dextrose. The dose for pediatrics is going to be 0.5 to 1 gram per kilogram given IV. Now, depending on what kind of dextrose I have, if I have D10, I'll be administering 5 to 10 milliliters per kilogram. If I have D25, it'll work out to 2 to 4 milliliters per kilogram. Or if I have D50, it'll work out to 1 to 2 milliliters per kilogram. If you do the math though, all of these volume-based doses will still equal 0.5 to 1 gram per kilogram. Now the funny thing about treating this patient with just dextrose As this patient has a functioning pancreas, the body will naturally produce and secrete additional insulin in response to my dextrose administration. So my patient will have periods of euglycemia followed by a drop into hypoglycemic levels again. The most definitive pharmacological treatment I can provide this patient to prevent these swings from euglycemia to hypoglycemia is by administering the medication octreotide. Octreotide is a medication that mimics the naturally occurring hormone somatostatin and will actually inhibit the secretion of insulin from the pancreas. This, coupled with the dextrose therapy, will prevent further slips into hypoglycemia. Octreotide is dosed at 1 to 1.5 micrograms per kilogram up to a maximum dose of 50 micrograms, and this can be administered either IM, sub-Q, or as an IV infusion over about 10 minutes. And finally, rapid transport. And that's it. If you like this card, please make sure to head over to my channel for more. And while you're there, check out my other videos and playlists like Pro Tips and Static Cardiology, and of course make sure to check out the other Static Pharmacology videos. Again, thank you so much for watching. Keep washing your hands, and have a good rest of your night.